Meet Dr. James West, surgeon and a legend in the field of alcohol and other drug addiction, treatment, and recovery. Born Chicago, 1914, earned his MD at Loyola University, practiced surgery for 40 years, and was an assistant clinical professor of surgery at Loyola School of Medicine. One of two doctors who performed the world's first human organ transplant, a kidney, at Chicago's Little Company of Mary Hospital. Later, he completed advanced studies in psychiatry and taught at the University of Chicago. Dr. James West, a man for whom the word retirement does not exist. In the 1980s, he became medical director of the world-renowned Betty Ford Center. Later, vice chairman of the center's board of directors and medical director of outpatient programs. Dr. West still lectures widely. He's author of many surgical and medical journal articles, and of this, the Betty Ford Center Book of Answers. Jim West has been in recovery for many years. When he talks, people tend to listen.
Addictive disease is usually called chemical dependency, but it is a disease, and it is characterized by the compulsive use of a psychoactive substance that has as its target organ the brain. And which psychoactive substance, be it alcohol, heroin, or cocaine, one of those substances, has the pharmacological effect of changing mood. That's all these addicting drugs do. Most commonly in the United States, nicotine, alcohol, heroin, and cocaine, and analogs of them, like substances, are the drugs that produce most of the chemical dependency or addictive disease. It's the same term that we deal with when we're treating these patients. Now, I want to give you a definition of addictive disease. Addictive disease is a biogenetic psychosocial illness. It's characterized by compulsive use of a substance, loss of control over the use of that substance, and continued use in spite of adverse consequences. It's inevitably progressive, and it's frequently fatal, like other, I call them malignant diseases. A malignant disease, by the way, is a disease that has a high death rate without treatment. The disease is also characterized by a distortion of thinking, most notably denial. I'm going to give you another definition that is more homey, you might say. The patients like it better because they can understand exactly what it means. I'm going to use also alcohol as the prototype of all psychoactive substances, and I can do this because the brain sees all of these psychoactive substances as using the same neurological circuits and having the same end result. There are differences between the action of cocaine and heroin and marijuana and alcohol, but the basic effect of its use, the reward for which people use it, is the same. And here's the definition now that I want to give you that's not exactly like the medical definition, it's simpler. Alcoholism is a disease characterized by the use of alcohol to the extent that it interferes with a person's home life, work, interpersonal relationships, and eventually his or her health. And its use is a prerequisite to feeling normal. Now, having defined the disease, what I'd like to do with you is let's look at the causes of the illness. Well, first of all, I have to say that this is like 70% of all the diseases known to medicine. We don't know the cause of this disease. But not to worry, we can design an effective treatment for most of the diseases, the causes of which we don't know. For instance, we don't know the cause of any of the cancers, the sarcomas, the lymphomas, the leukemias, but for those that are treatable, we have a treatment. And that's the way it is with addictive disease. Now, we do know some things accompany the illness as the person goes into it. The first is a genetic predisposition. There are two ways that this works. There's what we'd call a type 1 genetic predisposition, and we'll use a clinical example for this. Let's take a young lady. She grows up in a family. Her mother is alcoholic, say. Or to make it interesting, let's say the mother's not alcoholic. Let's say the father is alcoholic, because the disease can be passed from father to daughter, father to son, mother to daughter, mother to son. But we'll make it even more interesting. Let's say that the grandmother was alcoholic and neither parents of this young lady exhibited any signs of alcoholism. Anyway, she grows up in a family, goes to high school, goes to college, has a couple of drinks in college, is a social drinker. On one or two occasions, she has enough so she can feel it, and she finds it revolting. Revolting because she hates the idea that this stuff gives her a sense of losing control of herself. And this is so unattractive to her that she's really what you would call a very minimal social drinker from here on. She has another agenda anyway. She's going to get her degree, get her graduate work done, get married, have kids, and this happens to her, and she's a very successful attorney or physician or architect or whatever. And she goes through her 20s and most of her 30s. But according to the Center for Disease Control, this kind of a person has an experience around the age of 36 or 37, and there's a start of a bell-shaped curve in her history, as it is in the population of people with alcoholism, so that by the time she's 42, her alcoholism has reached the point of loss of control and the other things that require or mandate that a person needs treatment. What happened to her? Here was a lady that drank very little or nothing. She's a very successful person, but somewhere in her late 30s, something happened to her, and all of a sudden, how alcohol affected her was totally different. She found out that if she took a drink, she had a tremendous sense of relief. And we say to her, as we're questioning her, what happened to you back there around the age of 36 that changed you so much? And she'd say, I can't really tell you what happened to me. I just know that when I drank, I had a tremendous sense of relief. So much so is that common in this late onset kind of alcoholism that we call the initial symptoms relief drinking. What happened to her? We think she carries within her array of DNA certain genes that she inherited from her grandmother through her mother that put her at risk for alcoholism or addictive disease, because it could have been any other drug that had a psychoactive effect. But in order for that array of genes to activate alcoholism in her, there had to be what we'd call a powerful environmental trigger in her life. Now, what this trigger would be varies with the person. It could be a loss. It could be an illness. It'd be some kind of a major thing that had emotional impact on her. This is what is called an environmentally driven alcoholism. But for the environmental trigger to affect her, she had to be susceptible through genetics. Why wasn't the mother alcoholic? Because neither of her parents were alcoholic, and the mother was the daughter of the alcoholic grandmother, because the mother never experienced an environmental trigger that would have activated her alcoholism. So that's one kind of genetic predisposition that we see in people with alcoholism. It's called late onset. Now, it can occur in the early 30s or in the late 40s, but the average number in a bell-shaped curve by the Center for Disease Control is about the age of 42. There's another kind of powerful genetic predisposition that has nothing to do with environment. And this is an alcoholism that's inherited from an early onset alcoholic father to his son. There are some girls that develop this alcoholism, but it's rare. It's at least 40 or 50 to 1, male to female. And this kind of genetically passed alcoholism from father to son. Now, when that boy takes his first drink at the age of 11, that's when the Center for Disease Control says that males in the U.S. have their first sip of an alcoholic drink. This young guy gets something from it that his pals, who are probably drinking out of the same beer can, do not get. He sees this thing as something that's powerfully positive to him. He doesn't analyze it this way, but he sees this as a great thing. And from here on, his drinking is violent. That doesn't mean that he's going to drink every week or every month or maybe every 6 months, but whenever he does, his idea is to drink until he gets drunk, because there's where it is for him. The father had the same history. Let's say the father stopped drinking when he was, maybe 21 or 22, and he has this son when he's about maybe 27 or 28, long since sober, this father. Let's say the father has 4 boys over the years. We know 4 are going to be very susceptible to alcoholism and 2 probably won't be. But it's a 50% chance that those boys, maybe 75% in some studies, that the boys will develop alcoholism. Now, when this young boy is about 20, he has a history of getting kicked out of school, fights, arrests, and all kinds of antisocial stuff. The father has the same kind of a history. But there's some other factors in this kind of genetic predisposition. When we do a brainwave study on this father, we find out his brainwave is abnormal, and the P300 wave has to do with a response of the brain to certain kind of stimuli. There's a delay when there shouldn't be. When we do a brainwave test on the young boy before he has his first drink, because we don't want to contaminate the test by having had alcohol before, no matter how long before or how little, we find that boy has the same kind of abnormal P300 wave in his electroencephalogram. So we call this an electrophysiological marker, something that tells us that this young fella is very prone to have alcoholism if he drinks, because this is almost entirely hereditary, is almost totally oblivious of any environmental features. The daughters are spared usually in this kind of alcoholism, this kind of genetically predisposed, very hereditary alcoholism, but they develop to an extent that's about 15 to 20 times as it would occur in the general population, a condition called diversiform somatization disorder, which merely means that their lives are plagued by all kinds of psychosomatic complaints, none of which can be identified by any medical test. It's a psychosomatic condition. We don't know why that happens. So that's a kind of a general idea of how hereditary plays a role in the cause of the disease, but it's not the cause of the disease. There are other things. We also know now through recent scientific advances, especially in imaging techniques, that means taking pictures of the brain through what we call scanning devices like single photon emission computerized tomograms. Those are the common kinds of things that are used, or imaging techniques, to show what's happening in the brain of a person who, say, for instance, let's say a person who's recovering from cocaine. He's been abstinent about 6 months. He's determined to stay well and free of the cocaine, and we're doing everything we can to make it that way. But let's say we say to him, we'd like you, if you think you can do this, look at some cues, C-U-E-S, reminders of cocaine, because we want to see what's going on in your brain when this happens. And this happens. We show him the video, and we say to him, while the video is going on, how do you feel? He says, I feel the tremendous kind of craving. I can feel it in my throat, because he smoked cocaine. That's the quickest way to get it to the brain. And we look at the scanner, because we're scanning him at the same time, and we find out there's an area lights up in the left frontal lobe, some a little bit on the right lower part of the frontal lobe, and another area right in the middle of the bottom of the brain called the amygdala, which puts a kind of a feeling or a color on each perception. That is, everything you remember is either remembered as joyful or sad or neutral. This is apparently very powerful, and we know from what happens when a person uses cocaine, that exhilaration, that this is a reflection of what happened before, and it lights up with the scanner. So we have an idea now in the brain where craving occurs. Another thing we've learned through studies with animals and also in humans, that there extends from the top of the spinal cord at a place called the locus ceruleus, a cable of nerves that runs along the bottom of the brain to the front of the brain. And this cable is called the medial forebrain bundle. All psychoactive substances activate this cable because it ends in an area where there's a chemical that provides for any user reward. The chemical is called dopamine. Nicotine, alcohol, opium of all types, cocaine, and all the amphetamines, all react in the brain, but the activation goes along this median forebrain bundle. That's why I said I'm going to use a prototype for all drugs when I say alcohol, because the brain sees it as a stimulator of the median forebrain bundle that's part of the reward system, for which everybody uses drugs who's addicted, and for everybody who wants an occasional drink, because it'll even work with a mild stimulation without a person becoming addicted. So there's a commonality in what goes on in the brain no matter what system is used, what drug is used. Now, we know also that if a person exposes that median forebrain bundle to enough chemical, cocaine, alcohol, whatever, for a long enough period of time, a metaphorical switch is thrown, and never can a person use any psychoactive substance again without great risk of loss of control. We know these things about the brain, and we're learning more about it all the time, these scientists who do neurobiology. But that's not the cause of alcoholism. These are things that will lead us one day to the cause. By the way, I want to tell you what kind of a disease this is. I told you this was a disease. This is a mental disease. It's a mental illness. The National Institute of Mental Health does a survey, the National Catchment Area Study, every few years or so to determine the incidence of mental illness in the United States. And this is what they found. This is what they find every time they do this. The most common mental illness in the United States are the anxiety disorders. Those are the fears, the dreads, the phobias that make people's lives miserable, all the way from being nervous all the time to not being able to leave their home. It's characterized by panic states and phobias. The next most common mental illness in the United States are the substance use disorders, and that's what we treat here at the Betty Ford Center. And the third most common mental illness in the United States are the affective disorders or depressions. And the reason I mention these three is not only to tell you that it is a mental illness, but also to tell you that not